So December 20th, the FDA approved sleep apnea to be one of the qualifying diagnoses to get Zepbound. What does that mean exactly? Okay, so first thing first, let me tell you what Zepbound is. Zepbound is a medication that is used to help with weight loss. It's a GLP-1 injection you take once a week, and it's been around now for about a year, and so people are actively losing lots and lots of weight on Zepbound. Okay, the active ingredient in Zepbound is terzepatide, and you may have heard of people talking about Mounjaro. Okay, so Zepbound is an awesome product for weight loss. Okay, so now how does that play with the sleep apnea? So OSA, obstructive sleep apnea, is the actual diagnosis. What is sleep apnea? So basically, sleep apnea is when you're sleeping the back of the tongue. So when you're up and you are able to be moving around, it's easier to get access to oxygen in and out. But when you're laying down, it kind of depresses on that airway, so it causes the tongue to fall down, like kind of lay down in the back of the throat, which makes it harder for you to get air in and out. Okay, so during sleep apnea, there's times that you actually stop breathing. Okay, and so that's one of the things. And they use, if you've heard of a CPAP machine, CPAP machine is a machine like a kind of like a nebulizer machine, but it's different. But you put it on as a mask that gives you oxygen, so that can make sure that you don't go without oxygen when you're sleeping. Okay, and it causes a lot of anxiety because, of course, if you're thinking that you're gonna stop breathing while you're sleeping, that's very scary. And people with sleep apnea wake up, with headaches, tiredness, gain weight is one of the things that happens. And so their thinking is giving you Zepbound being approved now for sleep apnea, which is amazing news, right? So they're thinking because basically if you could lose the weight, that'll help, decrease the sleep apnea episodes. Hopefully is the plan. So together it should give you a better quality of life. So sleep apnea is a big deal. You pretty much have to get diagnosed through a sleep study. So you'll go see your doctor. They will refer you to a sleep clinic, and they'll watch you sleep and see what goes on during your sleep. How long do you go without breathing? How many times you wake up during your sleep during the night? They're going to watch you throughout the night while you're sleeping, okay? Just to see how you're doing. That way they can kind of figure out how to treat you the best, okay? They do have some surgeries for that. Most people don't want to go that route, but there is surgery alternatives if that's something you would be interested in. But being able to get Zepbound now would be awesome, because that would be a way to lose weight and also do better with your breathing, which is important. Okay, so that's super exciting news about the FDA approved Zepbound. Now, here's the problem. If the insurances still won't cover, it's going to be the problem. So now that it's approved, it's going to be up to your insurance policy if that's something that they're going to cover on your policy. Hopefully, yes. It's going to help the patients overall. But again, the struggle is getting the insurance companies to get on board. So if they will approve it, then basically all you got to do is go to your doctor, ask them to give you a prescription, and you can go get it filled for Zepbound. The problem is if they still may say no, and you may need to get a prior authorization approved. And the prior authorization is going to come from your doctor who gave you a diagnosis with sleep apnea to say, hey, this is medically necessary. This patient needs this, or their quality of life is going to be poor. So it's still going to be some fighting with the insurance company to get it approved. So I'm hopeful that they will just approve it, because this could change the lives of so many people. But again, these insurance companies are wanting to fight with us about getting this medication, because this medication is $1,200 to $1,400 a box for a month's supply. So it's one injection per week, and they just don't want to cover the cost. They don't care if it would make you better, which is unfortunate. So yeah, let's just stay tuned. Let's see how this goes. But hopefully this clears up any questions you got about Zepbound and sleep apnea, and how the whole thing works together and how to get it. So we'll stay tuned and keep an eye on what's going on. Talk to y'all later.